Hey, mama. Are you looking for tips on how to breastfeed after having a C-section? Today, almost 1 in 3 moms will give birth by cesarean section. Giving birth surgically presents unique challenges to a new mom. Hi, I'm Andrea Tran. I'm a registered nurse and a lactation consultant, an IBCLC, and I've been helping moms and babies breastfeed for over 25 years, and I want to help you too. I have a YouTube channel and a blog called Breastfeeding Confidential, where I talk about all things breastfeeding. Now hit that subscribe button and that notification bell if you want breastfeeding tips and help, so you'll get notified about every new video I put out. Today, I'm going to talk about tips for breastfeeding after a C-section. Make sure you stay until the point where I talk about one of the most common problems that comes up when you are breastfeeding after a C-section and how to deal with it. So I've got 7 tips for you. Number 1, if you know ahead of time that you're going to be having a C-section, take a tour of the hospital. Find out what their policies are, find out how they're going to provide you with the most support that they can to help you have a good breastfeeding experience. Tip number 2. Now, you want to do skin to skin as soon as you possibly can. When you give birth vaginally, you usually get to do it right away if both you and the baby are doing okay. Now, some hospitals are starting to offer skin to skin in the OR, so that's one question you'll want to ask when you take a tour of the hospital, is if they offer skin to skin in the OR. If they don't, ask if they can make an exception for you. It's got to start somewhere. If you're not able to do skin to skin in the OR, then do it as soon as you see the baby in the recovery room. Just take off your hospital gown, strip your baby down to his diaper, and put him up on your chest and just let him hang out there. Often they need some time with mom before they're ready to breastfeed. And babies tend to be ready to breastfeed in that first hour after birth. So sometimes with a C-section, you need to be a little bit patient to wait for the baby to be ready to breastfeed. Now, the best breastfeeding positions after you've had a C-section are going to be positions where the baby is not putting pressure on your incision. One good position is the football hold. So with a football hold, you're going to support the baby by the neck and shoulders, get his backbone along your forearm so you can support him, and then you're going to bring him around on the side. So it'd be like that. And tuck his body up against your body, pull your arm in close so he's nice and close and supported. Another position that you can use is side lying, and that's where you're laying on your side and baby's laying on his side, and you're both facing each other. If you want to use the cross cradle position, you would want to lean back a little bit and keep the baby up high so that it's not putting pressure on your incision. To help you be comfortable in your positions, get a good pillow like the Boppy Best Latch. Now that's not like the regular Boppy, and I'll go ahead and put the link down in the description. It's got a nice firm side for newborns, and that helps keep them stable. And it helps avoid having what I call the Boppy black hole, where they kind of roll into that space that sometimes is created right after you've had a baby. So the Boppy Best Latch is probably the breastfeeding pillow I would have made if I had designed one. So tip number 6 is to keep a breastfeeding basket close by with all the things that you need in it. I'll go ahead and put a link in the description to a blog post I have where it tells you all the things you should have in your breastfeeding basket. And that way you don't have to be, getting up and moving around to get things that you need. You just keep things close by. Diapers, and there's a bunch of things. I'll put that link in the description. So the last thing I want to talk to you about is a common problem that happens when moms have had a C-section and are breastfeeding. Babies tend to lose more weight, and there are probably different reasons for that. But what you can do is breastfeed frequently. That is the number one thing that's going to help your milk come in, help your baby lose less weight. Also, after breastfeeding, you can do some hand expression and feed any drops of colostrum that you express to the baby. You can express onto a spoon, you can just express onto your finger and just, rub it on your baby's gums and tongue. And I'll go ahead and check out that video if you want to know about hand expression. The most important thing is that you be patient with yourself. It takes about 6 weeks to recover from a surgical birth. So don't compare yourself to moms who've had a vaginal birth. Just be patient, get lots of rest, take care of yourself and your baby. If you want to read more about breastfeeding after a C-section, check out my blog post, How to Rock Breastfeeding After a C-Section. And if you like this video, please give me a thumbs up, hit that subscribe button, and I'll see you next time, Mama.